Okay, we'll just go to the next session very quickly. And I'll use this opportunity to welcome my co-moderator, Dr. Tunde Shegun, to come and take us through that session. Please encourage him, welcome him to the microphone, Dr. Tunde Shegun, for the next session.
Thank you so much. So we're moving on quickly to the next session. Now, according to WHO, one of the building blocks of a health system is health financing. Without finance, we can't really move. And so this next session is talking about health financing post-COVID. As we all know, when COVID hit the whole world, financing for health, became skewed because we needed to curtail the virus. But when it came to sexual and reproductive health, there were issues and challenges. So for this next session, it gives me pleasure to invite those who moderate. Mr. Martin Smith is the MD FP2020 at the FP Secretariat coming out of Washington, D.C. You're welcome, Martin. So he's joining us online, and I'm happy we can see him and he can hear us. Also moderating with Martin is Dr. Chukwu Nkata. He's the founding partner of HSCL. Dr. Chukwu Nkata, please, you're welcome. So between Martin and Dr. Chukwu, they would tell us how this session will go. They would introduce the presenters. So you have the floor, please. Martin, Dr. Chukwu.
Thank you very much. So, Your Royal Highness, dignitaries present, ladies and gentlemen, great friends in Nigeria, all protocols duly observed. I hope a very good afternoon to you. As my colleague has just said, I'm Martin Smith. I'm the Managing Director at Family Planning 2020. It's great to be joining you all today, and I was proudly there in person with you all in the conferences of 2016 and 2018. Very happy to be joining you online today, and welcome to the final plenary session of what has been a great interactive and highly educative day one of the National Family Planning Conference. And this session is indeed about health financing post-COVID, our funds moving away from sexual and reproductive health. And as we start this session, I'd just like to pass over, and my co-chair in this session, Dr. Chukwu Nkata, is there with you in person. Great to have him with us, a great expert, health economist who's worked extensively on health financing reforms, on universal health coverage, and how family planning is integrated into benefits packages. So just a quick pass over initially to Dr. Nkata to say hello as we move into this session. Dr. Nkata.
Thank you very much, Martin. And thank you very much to all of us we know we had some glitches, so thank you very much for sitting through to this time. This is definitely a very important session because we know that even before COVID, there's always been the issue of financing, particularly around sustainability. So we do plead that you stay with us through this session. We promise it's definitely going to be very interesting and interactive. Thank you very much. So over to Martin.
Thanks, Dr. Nkata. So we have a combination of panelists and speakers with us who will be both in person there with Dr. Nkata and colleagues in the Wells Hall, as well as online. And so I'd just like to let you know who's going to be part of this session. So wonderful to have Dr. Kayode Afolabi, the Director of Reproductive Health at the Federal Ministry of Health, there with us in person. And Dr. Afolabi will be making an initial presentation to set the scene. So I do hope Dr. Afolabi is either on the stage already there. Dr. Nkata, or joining you very, very swiftly. Welcome, Dr. Afolabi. Also with us online, it's excellent to welcome Ulamula, the UNFPA representative in Nigeria. Great to have you with us, Ula. We're very excited to hear your insights as part of our panel coming up in just a few minutes' time. Great to also welcome Dr. Gertrude Odezugo, who is with USAID, a senior reproductive health manager with USAID in Nigeria, and an NFP2020 focal point, as UNFPA is as an organization, and indeed Dr. Afolabi, an NFP2020 focal point. Then we have other panelists that we're welcoming. I'd like to welcome Honorariode Ezire from the World Bank. He's a senior health specialist at the World Bank. We're very excited to hear your remarks as part of our panel in a minute, Dr. Ezire. And I understand, and Dr. Nkata, you can guide me here. We are hoping that that Dr. Abubakar Kofi from the National Health Insurance Scheme is going to join us as part of this session. I was hoping he might be there with you online, in person, but perhaps he's planning to join online instead. Dr. Nkata, can you guide me there?
I've not seen Dr. Kofi in the room. Do we have Dr. Abubakar Kofi from the NHIS, or is he joining virtually? Okay, so maybe we'll just continue, hoping he joins at some point. But just to quickly mention that Dr. Afolabi from the Ministry of Health will be joining later, but is currently being represented by Mr. Lawrence Anyanwu, who is already seated here with me. Thank you very much, Martin.
Great, thanks. Thanks so much. And I will just give a very quick introduction, and we need to move into this session. I know Ulla and one or two other colleagues are obviously operating on a tight time frame, with today running slightly behind schedule. So I do really appreciate everyone's patience here. So just a quick scene-setting piece of context here. So from an FP 2020 global perspective, obviously as the COVID-19 pandemic has unfolded across the global economy and health systems, governments in FP 2020 focused countries and donor countries are really adjusting to a set of new realities, of course. Health resources in many countries are being redirected to cope with the pandemic that is posing a very significant, immediate and ongoing challenge to family planning programs. And a pandemic-related recession in many countries and to some extent globally will, of course, have knock-on effects throughout the world, potentially imperiling family planning resources for some time to come. The outlook for the next decade, even apart from the impact of COVID-19, suggests that international donor funding for family planning will remain essentially stagnant or fairly flat over the coming period. And the modest shift that we have seen to domestic resources in the past 8 years, and that's been seen in a number of FP 2020 countries that have allocated budget lines for family planning services and commodities, and Nigeria is one of these countries. That's a very positive trend that will need to continue or even increase for further progress to be possible. We have, of course, the global commitment to universal health coverage as a key part of this discussion. We look forward to Dr. Nkata and the panelists' views there. It's clear that this future will be broadly supported in terms of integrated health systems and family planning as a key component. And UHC schemes will need to feature a strong focus on primary health care, including sexual and reproductive health, including family planning. And obviously there's a great deal to talk about in that regard in the Nigeria context under the Basic Healthcare Provision Scheme, the National Health Insurance Scheme and primary healthcare under one roof. So a lot to get into. Now, Dr. Nkata, having given that intro and setting out our objectives for the session as understanding the SRH funding landscape in Nigeria in this post-COVID period and understanding emerging donor funding and funding mechanisms, I think, Dr. Nkata, are we going to have Dr. Afolabi's presentation a little later once he joins us? and perhaps we can get into some initial panel Q&A in advance. Is that the best approach, Mr. Co-Chair?
So Dr. Afolabi actually has his colleague here,
Great.
Mr. Lawrence, who will take the presentation. But let me also quickly introduce Dr. Ebere Anyachuku from DFID, well, formerly DFID, the health specialist, who is also meant to join us here on the panel. So Dr. Ebere is here with us in person.
Great. And Dr. Nkata, then if just in passing to you to hear from the Federal Ministry of Health, let's bear in mind, please, that we will need to get to UNFPA representative Muller's remarks fairly swiftly because of the hard stop that she has, I think, in about 15 or 20 minutes from now. So over to you, Dr. Nkata.
Thank you very much, Martin. So we'll pass it over to Mr. Lawrence from the Federal Ministry of Health. So Mr. Lawrence, you know, we've already lost quite a bit of time. So we'd appreciate if you keep your presentation to about 7 to 8 minutes so that we can also take the UNFPA comments before she has to leave. Thank you very much.
Thank you, moderators. As we all know, Dr. Afolabi was built to make this presentation, but because he is not available, he has asked me to step in. My name is Lawrence Anyao. I'm Director of Family Planning in the Federal Ministry of Health. We know that health financing is a very important pillar in health management. And anything that will make financing to be lacking or inadequate will definitely disrupt the health program. So COVID-19 came and it caused a lot of disruptions. So before we go into how it will affect programming subsequently, it will be good to know how it really affected health programming, particularly sexual reproductive health in Nigeria. Next slide. So by way of overview, as a result of the COVID pandemic, sexual and reproductive health services were not prioritized. The priority was given to the curtailment of the effects of COVID-19 pandemic. And so the Federal Ministry of Health came up with a COVID-19 response plan. And the initial plan did not prioritize RHFP services, which was understandable because all the available funding, most of it were channeled to appropriately responding to the COVID-19 pandemic, both at the federal and the state level. And in the course of that, RHFP services suffered. At the global level, we are aware that the fragile supply chain management system was exposed in the area of both manufacturing, shipping, and logistics management. Everything slowed down because of the restriction in terms of movement. So people were not moving, and production stopped. So it was difficult to get products across the globe because of the ban on movement. And on UNFPA side, it was the estimate was that about 47 million women would have lost access to modern contraception. And if it continues, this will be a major problem. And we are likely to have a surge in unintended pregnancies that will be almost 7 million. At the national level, due to the restriction in movement and the prohibition of meetings, we had poor coordination of RHFP services because things were not happening. Virtually everything was at a standstill, and it led to disruption of service delivery at the community level. Because commodities were not distributed in time, we experienced stockouts. We also know that available guidelines were lacking in COVID-19 protocols on how people, both providers and clients, could be protected in the course of receiving services. So that put fear in people, and they were not venturing out to seek services. Another issue was the unavailability of personal protective equipment. This caused a lot of problems, and because people had concern of risk of contracting COVID-19, the health facilities were deserted. Next slide, please. Now, all of this translated to negative impact on service uptake. And a quick look at the graph here shows that COVID-19 impacted negatively on the uptake of RHFP services. When you look at the graph, you see the trend in terms of injectables consumption, implants, and IUDs. All of them declined, and at the initial period, and they started peaking, taking up again subsequently. So altogether, we had an overall decline of like 35%. Yeah. Yeah. Then, yeah. Then in terms of impact on providers training, people could not really continue with training, and there was a big decline. So next slide, please. The impact is obvious. Next slide, next slide. Between January and September 2019, we had a total of about 11,870 providers trained. For the same corresponding period in 2020, we had only 825. So that negative effect translated also into the number of trainings in family planning and LAC. Next slide, please. So this had a serious dampening effect in terms of service delivery. The whole pandemic had an economic impact because the society was completely shut down. The detailed outcomes, negative outcomes are outlined here, but for want of time, I think I will skip this. Next slide, please. Next slide. Okay. The Federal Ministry of Health took a number of steps to address the impact of COVID-19, and these are outlined here. In terms of the risk to funding and impact of SRH, the situation is that increasingly countries are taking self-preservation positions on edge to increase savings. So countries that used to support Nigeria financially, donors that used to support Nigeria financially, there was a reduction. Talking about budget in Nigeria, the government had to reprioritize. The government had to look at the budget again, but luckily for us, financing for family planning was not completely removed. It was still prioritized, and what was appropriated was left there. So we are presently in the process of assessing the amount that was appropriated. Lastly, there was poor and reduced funding with huge implications in terms of service availability, universal coverage, in terms of training and service provision, and commodity availability. Okay. So, but we are still hoping that as we continue to program for reproductive health and family planning, that family planning will continue to be prioritized, and necessary funding will be gotten locally and domestically and internationally to continue providing services. Thank you very much.
Thank you very much, Mr. Lawrence. Please, can we have a louder round of applause, please? Yeah. Thank you very much. I'm sorry we had to rush through this. We hope during the discussions we'll have the opportunity to, discuss in more details the presentation from the Federal Ministry of Health. So over to you, Martin, so we can hear from the UNFPA. Thank you.
Thanks, Dr. Nkata. Thank you so much for that scene-setting presentation, Mr. Lawrence, the useful insight into the service delivery statistics, the impact of Minister Ehenere's statement on the importance of prioritizing family planning. Good to hear that that funding is being secured for family planning in what has been an understandably tight budget position with a lot of realignment going on. I saw the mention of FCDO of the UK. I'm sure Abere, who's there on stage, will want to get to a couple of those points in a second. But before we do, Ulla, it's wonderful to bring you into the conversation. Fascinating to hear your insights, UNFPA's continued excellent support to the government, of course, but really would like to hear from you on how you're seeing the impact of COVID in terms of the overall funding for sexual and reproductive health, and what you see as UNFPA's key sort of strategic focus with regard to financing for SRH and family planning in Nigeria as we move forwards in this new normal. So over to you, Ulla.
Thank you very much, Martin. And please allow me just to stand on established protocol as I move into answering this question. I think, I think many things have been said. I've been listening in through the day. We never had an opportunity. And I think what is clear to UNFPA is that when we look at the funding landscape, Martin, we are really worried. Because what we do know is, and it was also mentioned now, we know that funding is stagnating. And we do see a dwindling pipeline, and it's very limited what we have confirmed in terms of new commitments post-COVID. So while existing commitments have not been altered, and we're very grateful for that, what we also do see is that it's a little more uphill to secure funding post-COVID. And that is particularly concerning in a country like Nigeria, where we know we have a high unmet need and we have a very low CPR. CPR stands at 12 and haven't moved significantly for a long, long time. And what we've also seen, of course, looking a little bit on service uptake, is that despite all the good efforts, and I must commend the Nigerian government for the way that they were fast to move and get family planning recognized fully as part of essential services in Nigeria so that it continued to be available. But despite that, at community level and at state level, what we have seen is a decline in women accessing family planning services. And that goes for both short-term methods and for LARCs. And that in itself is concerning because we all know that leads to an increased higher maternal mortality, and there's a lot of other things that comes with that. I think, when I sort of look at what is concerning is, of course, there's for a lot of cultural reasons, and some of the reasons are very well understood in this country, progress on CPR has been slow. Those of us who remember 2012, when FP2020 pledges were made in London, at that point, Nigeria pledged a CPR by 2020 to be at 36%. That was then adjusted in 2017 to 27%. And that has now gone to 27%, so we remain at the same level, but we have bought 4 more years, so it's by 2024. And I think what we do see in that number is that we do see a federal government who is indeed committed and dedicated to ensuring access to family planning, but also that the journey is longer and there are more challenges than we thought originally when we started. And also, of course, COVID-19 haven't really enabled that. I think we need to change the narrative about family planning. I think we need to really start looking at what is it about family planning that is so important when we talk about achieving the Sustainable Development Goals. So for instance, right now, Nigeria has a population growth that exceeds the economic growth. That is going to lead to an increased poverty in the country. Family planning plays a key role in that. And that is part of accessing funding for family planning is actually reducing poverty and going towards SDG 1. And we can tell that story for each and every SDG that is out there. So I think that is a critical part of it. I don't want to take too much, I don't want to cram the microphone, but I think it's really important that we start seeing family planning as an enabler. One thing that can drive all the Sustainable Development Goals and is critical if we want to deliver the Sustainable Development Goals. And in that also, of course, all agreeing that no woman should die from a preventable cause related to childbirth, and that we should not have unmet need for family planning in 2020. I think I would rest it at that, but also, again, commend the Nigerian government and say we have an excellent relationship with the Federal Ministry of Health and also at state level in the states we work in. So I'm excited that we are able to go through with this conference. And I hope I've provided a few answers and a little bit of context and thoughts to the questions you asked, Martin.
Thanks so much, Ulla. Really thought-provoking, sobering, but giving us a clear direction, I think. And you raise an excellent point, which I think is very good continuity as we move to hear from Dr. Odezugo from USAID. You mentioned about relating family planning to the SDGs, and indeed, Dr. Odezugo, Ellen Starbird and colleagues at the agency set out a paper some years ago talking about 17 SDGs, 17 reasons to invest in family planning. And Gertrude, love to bring you in here in terms of your insights, sexual and reproductive health and family planning funding as far as the agency is concerned in this post-COVID environment, and perhaps also some thoughts that you might have on where implementers might focus as they adapt to their programs and their approaches in this new environment that we find ourselves in. So great to have you with us. Gertrude, over to you next. And I think you're still on mute, Gertrude. Easy mistake to make. I do it several times myself.
Okay, I think the organizers muted me. Thank you, Martin. Good evening, colleagues. Please permit me to stand on already established protocols. So I think I'll take the first part of your question, Martin, to say that COVID-19 is it's still here with us, and I believe it will be for some time. We are learning from our ongoing integrated programming supports to Bauchi, Kebbi, Sokoto, Ebonyi States, and the FCT. Our support ranges from health financing and governance to training of health workers and health managers, and also incorporating social behavioral change and communication to service delivery, and very importantly, family planning, commodity logistics management, which culminates in actual delivery of commodities and service delivery points. So we are learning and we are adapting our SRE strategies moving forward. And this is enshrined in the USAID's FY 2020 Journey to Self-Reliance Country Roadmap. Is outlined in our Country Development Cooperation Strategy 2020 to 2025, and it reinforces our choice of strategic priorities. And we very well understand the role of family planning in economic development, especially in a country like Nigeria. We believe that the COVID-19 crisis may also present an opportunity for Nigeria to demonstrate increased commitment to making the required fiscal and policy reforms that benefit more of the population. let me say here that USAID will continue to monitor the impacts of COVID-19 in Nigeria and reassess its strategic approach as needed throughout the implementation of our Country Development Cooperation Strategy 2020 to 2025. So to the second part of your question, Martin, talking about implementers and what we will do with SRH now and post COVID. So first of all, USAID's funding processes are such that planning and budgeting take place with enough lead time to ensure the annual funding coincide with the start of the new fiscal year. So sexual reproductive health funding for 2020 was available before the pandemic struck. We have continued our support at national and sub-national levels based on work plans as agreed with the states, but with modifications to accommodate for service delivery, behavior change communication, and infection prevention and control in the context of COVID-19 according to national policies and guidelines. So while we had to redirect some funds to facilitate states' responses to COVID-19, especially around communication and community engagement and readiness of health facilities to provide services within these guidelines, we were also able to continue with integrated health programming in these same states. As the Federal Ministry of Health already mentioned in the presentation, yes, we saw a decline in the first 2 months that the pandemic hit us. However, just like other donors and partners, we're able to work with state governments to actually continue service delivery and monitoring and evaluation. So through our implementing partners, Palladium, Kimonix, Bayan Global, DAI, and a lot of them, our focus is on system strengthening at the federal level, but mainly at states, LG, ward, and community levels, where we implement integrated approaches that we hope will build the resilience needed, at these levels to sustain health promotion. So we thinking about COVID-19 as an emergency and recognizing the fact that we may have subsequent emergencies, like working with states to be more strategic, in preparing for and really sustaining maternal and child health services, including sexual and reproductive health services. Over to you, Martin.
Thanks very much, Dr. Oduzugo. You raised two excellent points among many that I hope we're going to come to in subsequent parts of this discussion. The critical importance of the states in terms of financing as well as other aspects, and the importance of integration. And I know we will get onto this as we speak a little bit more about the health systems, strengthening work here and existing integration or further integration that we might see within emerging UHC orientated mechanisms. So great that you've set that up for us, Gertrude. And so I'm going to actually now work again with Dr. Nkata there in the room. And Dr. Nkata, great that Ebere is with you. Ebere, I'm very sorry that I missed you out in the introduction, but lovely to see you in the room there. I'm going to pass over to Dr. Nkata to take forward a couple of quick questions to you to set up your remarks, if that's okay, Dr. Nkata.
Much, Martin. So, Ebere, so taking it from the FCDO of the UK perspective, do you have specific strategic financing focus around sexual reproductive health? And are there any provisions for institutional and systems strengthening? Taking it just from where Gertrude ended, going beyond the actual delivery of services to also strategically support government to build the right institutions, especially taking the recent COVID experience where we've realized that, we do need these strong institutions and systems in place. Thank you very much, Ebere.
Yeah. Hello. Yeah, thank you. Thank you very much. In FCDO, yes, as the COVID-19 hit, I think it was challenging for everyone.
yeah, it was challenging for everyone, and we've seen Dr. Lawrence has projected what the impact has been on the family planning uptake around the country, which has been negative. In FCDO, we have a big focus on sexual and reproductive health. As you know, for several years, we've been supporting family planning commodities through UNFPA, usually at an average of around £3 million a year. But this year, we increased that to £4 million this year. And last year, just before the pandemic hit, we provided around £4.5 million for that. But also, we've also looked at the systems for delivering it. So systems for delivering commodities to the last mile. We've also invested in trying to improve those systems to make sure that the commodities actually get there. But then increasingly, from this year, we will invest even more on service delivery to make sure that the people who actually need family planning commodities are able to receive them. So things like training health workers and working with health facilities, and also some demand side work as well. Now, in terms of a strategic financing focus, yeah, sexual and reproductive health is a key part of our strategy in terms of supporting health systems in Nigeria. It's also a key part of our focus on demographics, on supporting Nigeria to achieve demographic dividend. And this is really important because, as I think was Ula that said, this is at the heart of development in Nigeria. Without making progress on family planning, we can't make progress on demographics. Without making progress on a demographic transition, we can't make progress in Nigeria in any area of development, whether it be education or health or economic growth or poverty reduction. We simply can't. It's fundamental to development in Nigeria, and this is something we've recognized. And so the work that we do in family planning and sexual and reproductive health is looking at this, and not just looking at it just from the health side, but also looking at it from education side, because actually you can't even improve family planning without improving girls' education. So girls' education is a big priority for us. Also looking at it from the social norms side, the women's empowerment, and the whole gender side of things. All of these things are so interlinked and very connected. So we're not looking at it not just from the family planning perspective, but from a whole development perspective, and bringing in all the bits and pieces to actually begin to make a difference in this area. So in terms of financing, yes, we do have it's a key priority for us, and in terms of institutional and strategic support, we are increasingly supporting the systems that will that Nigeria will use to develop this. So things like the Basic Healthcare Provision Fund is something that we've supported for more than a decade, right from when it was just an idea, and now it's being implemented. And so we are looking to support it, even contributing some funding for the Basic Healthcare Provision Fund, because we want to support those systems, those Nigerian, those long-term delivery and financing systems that are required to actually address these things. Yeah, thank you.
Thank you very much, Dr. Ebere. I think where you ended it on the institutional support, including to initiatives like the BHCPF, all the way from design to now, that we're ready to implement as a country. Implementation had started, but we know the guidelines have been revised. I'm hoping that Dr. Abubakar from the NHIS, I don't know if it's available online. Okay, Dr. Abubakar is not here. So maybe we just, Martin, maybe since Abubakar is not here, we just.
Dr. Nkata, if it's okay with you, sir, we'll move to hear from Dr. Ezire from the World Bank next.
Okay, yeah.
And then I'm actually going to come to you for a few of your comments in your professional capacity as a health economist and UHC expert. And then I do want to get into some Q&A. I believe as Ulla has moved out, our colleague, Dr. Sabrina Pestilli from UNFPA has also joined us online. So I hope that sounds like a plan to everyone. Please get your questions ready. And so Dr. Ezire, great to turn to you, and thank you so much for joining us online from the World Bank. And I'm very fascinated to hear your perspectives in terms of the longer term investments that we all are making, primary healthcare under one roof, our thinking around the integration of sexual and reproductive health in primary healthcare, the initiatives that you see, the Basic Healthcare Provision Fund that I know has been the Global Financing Facility and the World Bank have been closely involved in, the National Health Insurance Scheme, how you see all of these pieces fitting together. There's been long-standing investment in saving 1 million lives at the state level as well as part of this piece. So I'm hoping that you can give us a sort of uber financial perspective of how these elements are fitting together, what it means for family planning in the post-COVID environment. So over to you, Dr. Ezire.
Thank you very much, Martin, and thanks, Ebere, Kata, and other panelists. The World Bank is committed to addressing issues of sexual and reproductive health in Nigeria. And the World Bank approach to health is integrated. It's not vertical, but seeing that the whole gamut of issues around health are addressed, because somehow one affects the other. Currently, we have about 3 projects, and in each of them, we ensure that sexual and reproductive health is integrated in them. We have the ARIM project, which is a $250 million project implemented by government. I'll just note that the World Bank really doesn't have a plan of its own. It works with government to implement what government have identified as priorities, things that are important to government. So we work with government to implement their plan. So the ARIM project primarily is actually focused on nutrition, but because of the importance of sexual and reproductive health, it has a component that addresses adolescent health. Then we also have the Agile project. It's an educational project, but again, because we also attach a lot of importance to sexual and reproductive health, it also has a component on sexual and adolescent reproductive health, and that will be implemented in 7 states. Then we have the Impact project, which is a $650 million project that will be implemented in 18 states. And that also has a huge component around sexual and reproductive health intervention. Now, back to your earlier question. So because we are committed to improving primary health care, our approach is we are building on the DFF approach that Basic Care Provision Fund is implementing. And just to take a step back, the DFF approach is based on the assumption, not really assumption because I've been tested and it works, that when you transfer funds directly to health facilities, primary health care, and they have the autonomy to use those resources to meet the operational needs of those facilities, they're most likely going to provide better services, serve more people and all that. And evidence from the N-shape actually proved that. And that is what informed the design of the NPSA gateway of the Basic Care Provision Fund. So we're still going to continue to do that. Under the impact project, we're working in 12 states. We're going to support close to about 2,000 PLCs around the country to work with government to achieve the goal of 10,000 functional PLCs at what level. We're going to work with them to upgrade these facilities. Work with them to provide quality healthcare services, including sexual and reproductive health. Beside the funding that we provide, we also involve in other forms of analytical activities. One is the demographic dividend that Barry mentioned. We are working with the FID and other partners to see how we put that on the table and work with government to prioritize investment in yields and how, including family planning, to see how we can harvest the demographic dividend associated with population growth and all that. So the World Bank is committed. We think in doing all this, we should use the system approach. We should not just focus on one thing at the expense of others, but rather see that they are all connected and positioned to serve the needs of Nigerian women and children. I will stop there and possibly allow wait for comments. Over.
Thanks, Dr. Zire. Great to hear the wide range of investments that are sort of family planning centric and family planning sensitive in the service of the government's priorities in Nigeria. And we will be, we will be coming back to you in the Q&A section in just one moment. But I want to come back to Dr. Nkata there in the room, if I can. Dr. Nkata, unfortunately, Dr. Kofi from the National Health Insurance Scheme has not been able to join us, but I know in your professional life, you have a lot of very clear views on the integration of family planning in health insurance schemes. And I wondered if you had some insights to share with us on FP within Basic Healthcare Provision Fund, within National Health Insurance, and how those schemes may develop as time goes along into sustainable financing mechanisms for family planning, sexual and reproductive health more broadly. Be great to get some context from you here, especially in the absence of Dr. Kofi, unfortunately. So back to you, Dr. Nkata.
Thank you very much, Martin. So I think as a big disclaimer, I'm not from the National Health Insurance Scheme, so nobody should take anything I say as the views of government, particularly the NHIS. So, but I think what's happening around reforms for financing primary health care presents a huge opportunity for integration of FP and broadly MNCH services within packages that actually increases access and uptake of services. If we look at what's going on at the different levels, at the national level, we have the National Health Insurance Scheme. Now we have BHCPF, which complements that. Almost every state in Nigeria is at some kind of advanced stage in either designing or have already rolled out a state-led health insurance scheme. But one thing is common across all these schemes from the federal to the state level, which is when you look at the SRH component, you find that FP alongside I think HIV, TB, are most of the programs that are nationally led with with significant donor support are mostly left out in these packages. So when you look at FP across the federal and state level, you'll find the services that are covered are mostly the counseling component of the service, but the full method mix is not provided for, which raises serious worries for financial sustainability. If insurance takes hold as the mechanism for financing basic package of care for all Nigerians, right? than what happens when FP programs are not fully integrated. And this is actually the right time to really make, build a concerted effort and create what I'll call a broad partnership platform, because the issues that need to be resolved for integration to happen go beyond just government. Even from the development partner end, you find that there are differences in approach. I'll give one specific example around the supply chain for FP commodities, right? We have different approaches ranging from provision of commodities, FP commodities free in mostly public facilities, and in some states, even in some public facilities, to people sourcing it through social marketing and others outrightly through the open market. So if you're going to integrate that into an insurance scheme, there are some supply chain issues you need to sort out, because it affects how you'll be able to charge for and pay for those services. Because the insurance already has a fixed system for paying for services and commodities. But I think the conversation needs to actually, it's already happening, but it needs to be fast-tracked. And the time is now, because once these insurance programs, particularly at the state level and the BHCPF, get matured, it becomes very difficult to draw them back. And then lastly, on this very important issue of the demographic dividend, and I like the way Ebere put it, if we don't actually make the demographic transition and start seeing the demographic dividend, it will be difficult to achieve any meaningful economic growth. Now, another huge opportunity in that aspect is currently we have the federal government is leading the development of a new medium-term national development plan, right? That replaces the economic growth and development plan. So there's a new national midterm development plan being developed to run from 2021 to 2025. And at the same time, there is a longer-term plan being developed to replace Vision 2020, which is Nigeria at 50, that is going to again run from 2025 or 2021 to 2030. So it's time that the health community, it would be nice to have engagement with the Ministry of Finance, to have them sit in a room to actually understand how the big lever they need to move the economy, which is the demographic dividend, requires significant investment in FP. So to summarize, it's really, there are opportunities we must take advantage of right now, and COVID has made it easier for us health stakeholders to be heard in places where before, the doors were not exactly open. Thank you very much, Martin. And
thanks, Dr. Nkata. Some excellent points, and this platform that you speak about to set out a sustainable financing future for sex and reproductive health and family planning in the broader health sector and primary healthcare is one that I know is really a very active conversation, and we hope this is a thought-provoking part of that. Now we have, as I understand it, with the time fast approaching 6 p.m. there in Abuja, about 10 minutes or so for some questions and answers. And I'm monitoring the chat both in Zoom and on the website as much as I can. And Dr. Nkata, I hope you're looking for hands and monitoring questions as they are in the room. And so we'll try and dovetail this again between the online and the in-person elements of this session. And so I'm looking for specific questions, and I'll attempt, and Dr. Nkata will also, to direct them to the appropriate panelists. Dr. Sabrini Pestilli from UNFPA has joined us in Ula's stead at the moment. So I'm looking for Q&A. I'm looking at the website. I'm trying to make sure I'm covering all the bases here. I wonder, Dr. Nkata, if you have any hands up in the room there, a brave soul to get us started in the Q&A.
Thank you, Martin. So we actually have 2 questions written and sent in from those physically here. So the first question goes to FMOH, Mr. Lawrence. Somebody wants to know what's the current status of basket funding for contraceptive commodities in Nigeria is. Where are we with the basket funding for contraceptive commodities in Nigeria?
Okay, thank you very much, Nkata, and the person that asked the question. In terms of the basket funding, we have made some progress. When the second commitment was made, it's true that it was supposed to be 4 million United States dollars per annum, but for the year 2017, the appropriation had already been made, and based on the 3 million US dollars going on prior to that time. So what we had was 3 million for 2017 and then 4 million subsequently for 2018, 2019, and 2020. So when the Federal Executive Council gave approval, the idea was, the approval was based on what was appropriated for 2017, which was fully released that year, about 2.65 million US dollars. Last 2018, we had a full appropriation, which was released. Last year, we had some inadequacies in government funding, and we got about 300 million naira, which is like 900 and something thousand United States dollars. But because of engagement with the Honorable Minister of Finance, she additional approval has been gotten for that of last year, and to date, between 2017 and 2019, what government has paid is almost 7 million US dollars. That's outside the additional approval which the Minister of Finance has given. So we are processing that together with the fund for this year, which initial release will be about 300 million naira. So we should be mindful of the fact that our appropriations are being affected by the fluctuating exchange rates. So once plans are made to release a given sum of money, and seeing what is happening in the foreign exchange market, the international value goes down. So we have done fairly okay, and we are expecting some reasonable amount this year to add to the about 7 million US dollars we already have. Thank you.
Okay, thank you very much, Mr. Lawrence from the Federal Ministry of Health. There is also a question for Ebere from FCDO. Ebere, somebody wants to know how the BHCPF can also be used as a financing mechanism for SRH, particularly given the fact that DFID is one of the active supporters of the BHCPF.
Thank you. Yeah, actually, I think you sort of treated that question when you were talking about BHCPF and National Health Insurance. But okay, yeah. So I think you went into that question when you were talking about National Health Insurance and family planning. But the thing is that if BHCPF is meant to finance a package of basic health services, and if family planning is part of that package, then it enables us to be able to support family planning. Now, the thing about family planning is that a lot of the things that we provide, so we provide a lot of commodities for family planning. But sometimes those commodities do not include the consumables. So they charge people, even though they say the service is free, but a lot of facilities charge for those services. And so some of those user fees act as a barrier for people to access, even though the commodities are free. So this is somewhere the BHCPF can come in, because with BHCPF, every facility is going to get some amount from the NPHCDA gateway to do things like that. Make sure that simple consumables like cotton wool, syringes, and stuff like that are there. You know, also the NHIS gateway. So the assumption is that if you have that covered in the DHCPF, then it eliminates those user fees and allows more people to be able to access these services. Thank you.
Thank you very much, Ebere. So Martin, over to you. I don't know.
Yeah, thanks. Thanks so much. And I'm just going to ask a very quick fire question to our three panelists online, to Dr. Odezugo, to Dr. Pestilli, and to Dr. Ezire, which is, we heard this morning from Dr. Afolabi, from our Executive Director, Beth Schlatter. There will be commitments to the next family planning movement to 2030. I'd like to ask each of you for one recommendation for the government of Nigeria in terms of where their financial commitment as part of their commitment to family planning over the next decade, where that financial commitment should focus. So one quick recommendation of an area within financing for family planning where particular focus should be paid. Bit of a tough question, but one that I know you all have an interesting perspective on. And as I do this, Gertrude, I wonder if I can come to you first for that one key recommendation that you would have. Thank you.
Yes, thank you, Martin, and thanks again, colleagues. I think I'll take this down to government at the state level, so sub-national level, because at USAID we believe that that is where our manageable interest is, and that is where we can make more inroads. And so let me start by commending the federal government. They're already putting guidelines in place for state governments that are willing to procure family planning commodities for clients in the states. But going beyond that, I think the federal government and other donors and partners, that have financing funding for family planning have a role to play in supporting the states to put their money and any other, so domestic resources and even resources that can be leveraged from the federal, from the private sector, from wherever, to put them into ensuring access to family planning services, not just commodities, but the attendant services that come with them. And I think if we're able to make progress in the 36+1 states in Nigeria, well, that's Nigeria.
Thanks. Thanks very much, Dr. Odezugo. Focus on the states for financing. Very good, good guidance, I think. So we'll come over to you next, Dr. Pestilli. Sabrina, great to get your views on where you think some focus might be placed as far as financial commitments within Nigeria's commitment to the next family planning partnership. Over to you. Sabrina, are you able to hear me okay?
Oh, sorry, I didn't unmute myself. Sorry. yeah, what I was telling is that I actually think that Gertrude has made a point, and is a very good point. I think we need both. We need the federal, and we need the consistency of the federal financing. And I haven't at UNFPA, we are moving in a direction of co-financing. So these last years, whenever the government was not able to come up with their commitment, UNFPA was stepping in. This year, we moved from $14 million to improve the commodity aspect of it. But in the future, we will not be able to do so because we are moving in this area of co-financing. So at this point, I think the federal really needs to work more with the states to ensure that the financing comes from both sides, and that the states have also a ownership of this program, not just in terms of funding and supply and service delivery, but also in terms of supply chain and strengthening the last mile distribution. So I see that we have to move a bit from federal to state to ensure that the state have this ownership that allow the program to move at the pace we want.
Thanks, Sabrina. Very great perspective. Very interesting that yourself and Gertrude are somewhat in line. Dr. Ezire, your piece of guidance as the government of Nigeria contemplates its FP 2030 commitment and the financing of it, what would you say?
So I will reaffirm what has been said before. I think the Basic Healthcare Provision Fund has a lot of potential. I spoke with somebody from the Department of Health Planning, from Family Health, and I was told that we need about $12 million every year for commodities. $12 million turns out to be around 4 billion naira. Now, the Basic Healthcare Provision Fund alone in 2018 made provision for about 50-something billion. And if you look at it, I said it everywhere, that you cannot address the issue of maternal health, maternal death, infant mortality, under 5 mortality, without addressing the issue of family planning. So the Basic Care Provision Fund remains a very huge potential that I think that family planning advocates need to ensure that that money gets to facilities. Currently, it has been released from the national level. It is hanging somewhere between states and facilities. This money needs to get to facilities. And if we can continue to ensure that that money is used well and is a strong accountability mechanism, that fund is getting to facilities, and states are able to contribute something to that, then we're likely going to be sure of sustainable domestic funding for family planning.
Thanks, Dr. Ezire. A really excellent point as we conclude this session. And I'm getting news that we're already about 60 seconds over our time. But really fantastic insights from Mr. Lawrence of Federal Ministry, from Bere, Dr. Nkata in the room there, Dr. Ezire from Ulla, and Sabrina from UNFPA, from Gertrude from USAID. Very, very grateful indeed for your thinking here. It seems the future of family planning in the COVID context and across the next decade has to be all about integration, has to be using those sustainable financing mechanisms that the government has very sensibly, very cleverly put in place, and requires political will at the federal level, but very particularly at the state level to ensure that all of this is operationalized. Family planning, sexual and reproductive health, as we all know, critical to Nigeria's success, can be found in each of the sustainable development goals as we think about the path that Nigeria charts for itself over the next decade. So my sincere thanks to my co-chair, Dr. Nkata, and to Mr. Lawrence and Ebere there in the room, and to you all in the Wells Hall. And my great thanks as well to Gertrude, to Ulla, Sabrina, to Dr. Ezire and colleagues, and everyone who's joined us online. And Dr. Nkata, I'm going to hand back to you for the last word, as you're in the room, and you can do the handoff to colleagues, as I think we're moving towards the close of of this first full day of the Nigeria Family Planning Conference. Over to you, Dr. Nkata.
Thank you very much, Martin. Just to join you to say thanks to all our participants for staying through this. We know there's another session, so we'll just end it here. Thank you very much, and have a great evening.
Okay.